I'm just going to dive in. So first of all, to describe a little bit about what facial plastic surgery and facial plastics is, it's really addressing everything from the skin to the bone of the face. At the Aesthetic Center, we treat the skin from the outside in and from the inside out. So it's skin treatments, it's aesthetic treatments, lasers, it's injectable treatments. This is really I can't really say new anymore because some of these have been around for 30 years or more. But injectable in-office treatments, it's facial rejuvenation surgery, be it for aging changes that fortunately or unfortunately we all go through in different ways. It's addressing specific changes of the nose or of the ears, and many more specific things. My background is really covers all of these different areas, and I'll get to that a little more when we get to the surgical treatments. I like to say that the skin is the foundation of the face, and treatments of the face and taking good care of the skin is probably one of the most important things that you can do. And in a way, it's an insurance policy taken out on any more advanced or more invasive types of treatments that we do as well. So here's a picture of our lovely esthetician Amy, who couldn't be here tonight as she's taking care of her recently born twin boys. So, and I tell this to many people, so a few of you have perhaps heard this before, but there are really three things that you can do to take the best care of your skin. The first is use sunblock or be really cautious of the sun when you do get it. We all need our vitamin D, especially around here, but excessive sun exposure is one of the most common causes of facial aging and skin cancers, which is a whole other side of my practice. The second is don't smoke, and if you do, please quit, because it's one of the worst things for your skin. And the third and probably most important thing is pick your parents well. We all do have our own genetics and heritage, and we take all those things into account when we do any kind of treatment in the office. A few of the different in-office treatments that we do on the aesthetic side, microdermabrasion, chemical peels, quick in and out procedures. We have a number of different lasers, including hair reduction, hair removal lasers, pigment reduction, and skin resurfacing. And I'll cover a few more of those as well. I like to start off with injectables, as this is an area of my practice which is extremely busy and extremely successful. These are so popular because they're in-office treatments. There's minimal to really no downtime. Lots of people go right back to work or go out right afterwards. There's an ever-changing field, and there's sort of split up into two main classes or two different areas, and I'll kind of address those separately, but they're often used in conjunction with each other. Those main classes are Botox, which many people have probably heard of, and fillers. When I see the face, this might be a little interesting to see. When I see the face from a standpoint of Botox, Botox relaxes muscles, so I see underneath the skin all the different muscles of the face, which I can address in various different ways. Fillers are used in some of the areas that you see here. This woman, of course, doesn't need any of these, but it's good to sort of use this as an example. So sometimes I'll use some fillers in frown lines, in the cheeks, which isn't even listed here, the smile lines, in the lips. And I'll start by talking a little bit about the neuromodulators. Now this is Botox, botulinum toxin type A. It's got a horrible name. People think of it as a toxin, as a you're injecting a poison into your body, but it is none of those things. It's actually probably a purer and more refined product than most of the things you ate today, unfortunately. Botox is used to relax the muscles that cause wrinkles. So here's a great example of a woman who's frowning pretty hard before treatment and frowning after treatment. You can see all the lines and wrinkles are gone, and there's a side benefit of this, and I call it a side benefit because many people after having Botox feel a little better because they're not frowning as much. They're not really showing the expressions of sadness, and it's pretty interesting to see some of those responses. It lasts for about 3 to 4 months, and it helps with both dynamic, which are in movement, as well as static wrinkles. Static means when you're not moving your face, they're still softer. And here's a great example of that. Here's a woman who had what she called the Grand Canyon, in between her eyebrows. You can see up top when she's relaxed and down below when she's frowning. And we did a combination of the two. I did some Botox to relax the muscle, and I put a little bit of filler, which is a product that goes underneath the skin. And you can see when she's relaxed, the Grand Canyon is no more. It's the Grand Plains. And when she's frowning, you still can see nearly gone. She still has expression. She's still able to move her face and talk and express herself normally. I mentioned Botox addresses the muscles, but fillers is an ever-changing and very exciting field of facial plastic surgery. Fillers treat lines, wrinkles, and folds. I can put them at different levels of the skin, and there's a myriad of different types of products that I use to try to address some aging-related changes. Here's just a brief list of some of them, and there's many more. The woman on the left that you can see had some Restylane treatments. There was a number of areas that they addressed, under the eyes, in the cheeks, in the lips, in the smile lines, and I think she looks like herself, but she looks a little more refreshed and a bit younger. On the right, this is a male who had some smile lines. They're from smiling, so they're not a bad thing, but we all get them, and some people get them more than others. He had a Radiesse treatment to soften those, and I'll talk a little bit more about that in a bit. The most common fillers that I use are made of hyaluronic acid, and people wonder, what is hyaluronic acid? Well, it's a naturally occurring substance in the body. It doesn't contain any animal products, and I actually have never seen someone allergic to it. In some areas it lasts between 6 and 9 months. In other areas it can last up to 2 years. It is the same material that fills up the center part of the eyeball, and it's also present in the skin and in the dermis, and you probably have some in various different skin products that you use topically on the face, and that's a whole new area of kind of exciting new treatments using hyaluronic acid topically on the face. So here's a woman who came to see me. She said, I don't want to have surgery. I'm not ready to go under the knife, but I want to look a little bit better, a little bit more refreshed, a little bit younger. She was bothered a little bit by some of the lines between the eyes, but she really liked to express herself. She had a very animated face. She didn't want those to be gone. She didn't like some of the changes under her eyes where there was some hollowing. And some of the changes around the mouth, specifically in the corners of the mouth, this area we call the marionette line, which is a common area that things start to change. Here she is after a treatment with Restylane, so no surgery at all. I softened the lines in between her eyebrows. I softened the smile lines and nearly got rid of the little marionette lines that come down from the corners of the mouth. I also put a little Restylane under her eyes to raise her cheeks and sort of soften the cheek area. Again, another goal, keep her looking herself, keep her looking natural, but soften her appearance. Here's a nice combination of a little bit of Botox in between the eyes to lift the eyebrows and soften that area, and also a little bit of Juvederm treatment around the corners of the mouth and the smile lines. This is one where this gentleman came to see me, and he would go to work in the morning and everyone would say, boy, did you have a rough night? What was going on? And he was a real straight shooter and didn't do anything like that. And so he said, you know, I don't want to look like this anymore. So I put a little bit of Restylane under his eyes, and I think you can see that that really changed his whole appearance, his whole face. He looks more refined, he looks younger, he looks healthier, he looks well rested. Another example of just some softening of the smile lines, in the parentheses is another name we call these. Here's someone who might look familiar. So a little bit of Juvederm to the lips. A lot of people see lip injections as this scary thing. And done well and done appropriately and not over the top, it can really add a little bit of volume and a nice appearance without looking at all abnormal or fake. Juvederm Voluma was a pretty revolutionary new product that we've been using extensively for the past few years. It's been around for many more years in other countries. And its primary focus is to augment the bone of the cheeks where a lot of aging changes occur because that's where things start. And that's what leads to loss of volume that adds volume down below in the jowl area and leads to some of the changes in the smile area. So this is something that really at almost any age can be beneficial to raise the cheek and add a little bit of lift. At the same time as we did her lips, we added a little bit of volume to Katie's cheeks. And you can see it sort of adds a little bit more of a rounded nature. And this was her second treatment over the past couple of years. But you can see it really just kind of brightens things up a little bit. And I think certainly her lips, you can see just a subtle volume change, a little bit more pizzazz. Sculptra is a slightly different type of filler. It's made of a material that I use in the operating room all the time, a type of suture called Vicryl. And what we found is using these sutures, doing histologic studies, which is when they look at things under the microscope after people had these sutures in place, that it would form collagen around the suture. So someone had the bright idea of taking the suture, chopping it up into little pieces, and injecting it under the skin. What it did is revolumize the face on a more global scale. So not looking specifically at this area or this area, but really saying, well, if the problem with aging is loss of volume, what if we put volume back in the face? And I think you can see what a dramatic result this was in this woman. Made her look younger, took away some of the hollowing, specifically in the temples, in the cheeks. It did soften some of the lines around the mouth. Here's a patient that I treated a few years ago. Kind of the same thing. It just sort of softened some of the lines and wrinkles and volume changes. Made her look more well-rested. I really like this treatment, especially for very athletic younger women. Younger being a relative term, because I've used this many times in people in their 60s even, and it's a great way to revolumize the face without sacrificing overall weight. Last in kind of the filler realm is one called Artefill. Now this is now currently called Bellafill, and it's essentially a permanent filler. It's usually not one that I go to right away. It does require some skin testing beforehand. It can last for even 5 to 10 years based on the collagen response, and it does provide very long-lasting improvement. If you look, hopefully that shows up in the little orange boxes. This is someone before treatment, and they had a few treatments, but after 6 months, after a year, even after 5 years, it's still present. Now this is one that I use not for everyone. It's one that I typically go to after someone has had some filler treatments and wants to move forward with something that's more permanent. Now, being more permanent carries a little bit more risk. So that's always something we talk about and go over and do the skin testing.